Tuesday Tips. Thank you so much for joining. Every week we go over different topics of plastic surgery and I get to answer your questions. So this year, last week was our first Tuesday Tips of the year. And today we're going to continue this New Year topic regarding preparation for surgery. So last week we delved into kind of how to, like if you're thinking about surgery this year, how to go over this process and start, like choose your surgeon, what procedure is best for you, and when to schedule it. Now you have decided this is the year you're booked, how to prepare for surgery. I'm going to focus in the massive weight loss population. If you are a new follower to my accounts and you don't know, I do a fair amount of weight loss patients. All over procedures of the body for massive weight loss patients. The massive weight loss population is it's a type of patient that tends to have multiple procedures because the weight loss kind of affects different areas of the body, from the face, the neck, breast, chest in males, abdomen, back, thighs, extremities, arms. So I'm going to talk a little bit about the preparation for surgery with focus on the massive weight loss population, and then I get some questions, of course. So let's start by type of weight loss. So of course there are different types of weight loss, and there are some differences regarding the type of weight loss that you had, what specifically you need to be focusing on. So if you had your massive weight loss through bariatric procedure, there are more procedures for weight loss, but the two most common nowadays is the sleeve gastrectomy and the gastric bypass. There are, again, other procedures that are not as common, but these are the two that I see every day. The band or the balloon is also common, but again, these two are the ones that are most common out there. So if you had bariatric procedure, you have to wait at least 1 year to have your skin removal surgery or plastic surgery procedure. The reason for this is because in the early post-op period and within that year, there are going to be a lot of metabolic changes, healing, and also fluctuations in the weight. It's very common that after bariatric surgery, and we're seeing this with GLP-1 medications, so I added that there. The curve of weight loss is not linear. It's not that you start to lose weight and you reach your goal weight. This is not it. You are going to go through different changes. It starts with going down rapid weight loss. Then you see some plateaus, more weight loss, and then you may see some increases in weight until this curve stabilizes. That's where we want to be for plastic surgery or skin removal surgery, okay? We want all of these variables of when we do rapid weight loss, we see nutrition deficits. Nutrition deficits give you more complications after surgery. So we do not want you to have surgery when you're in this rapid weight loss. And that's the same for GLP-1 medications. GLP-1, we're seeing a similar curve in regards to rapid weight loss initially. If you go and have surgery there, you may see weight gain and you may see malnutrition at that stage, which are going to increase your risk of complications, and it's going to affect the results if you gain weight afterwards, okay? So we want to have at least 1 year post-op. For GLP-1 medications, it's really similar to weight loss. That goes, like people call it naturally. I mean, it's just that you lose weight through diet and exercise. That's the other way of losing weight, right? If you have GLP-1 medications or weight loss through diet and exercise or bariatric surgery, you should be 6 months on this stable weight curve, okay? The reason for that, again, is to stabilize all of this that I'm going to talk a little bit about in a bit, but also decrease the chances of those fluctuations of weight, which are going to affect your results, okay? So this is the most important. If you had your bariatric surgery 1 year ago, but you are still in this phase, then you should wait a little bit longer for your plastic surgery. You should be 6 months of stable weight regardless of the 1 year post-op surgery. So the two need to be true, okay? And this takes me to I think the most important topic regarding preparation for surgery for weight loss patients. With massive weight loss, we lose fat, but we also lose protein. Protein is our biggest wound healer. So So when we're going through surgery, there is an inflammatory cascade and response our body goes through to heal our body, heal the wounds, heal the tissue, heal the liposuction areas, and this is all based on protein. So this is so important, and because of the decrease in caloric intake that we go through, either through surgery, through GLP-1 medications, and for those of you that are not following what GLP-1 is, those are Ozempic, semaglutide, tirzepatide, all of those fancy names, those are all GLP-1 medications, okay? So protein decreases because, one, you're in a catabolic state, or you are burning fat, burning protein to lose weight. So your own body is decreasing your proteins, and also your intake is less than it was because you are decreasing your total caloric intake, so you're taking less proteins as well. So your body is going to have a combination of loss, not only through the intake, but also increase in the metabolism of your proteins to lose weight. So it's important that when we're preparing for surgery, if you've had bariatric procedure, you are in some supplements, and you should be following up with your nutritionist or your bariatric surgeon to optimize those supplements as time goes by. If you have weight loss naturally or through GLP-1, you should be checking with your PCP or nutritionist just to make sure that everything is up par for surgery, okay? But this is the most important one. Magnesium, zinc are also very important in wound healing. I didn't include here, but vitamins, okay? The vitamins, especially vitamin E, vitamin C, vitamin D, are all very, very important. So all of those levels should be up par. So you should be checking your levels before surgery. I am going to ask you to stop some of the multivitamins and supplements you have before surgery. So this preparation for surgery, it's really not the month before, because I'm going to ask you to stop some of these because most of the multivitamins have supplements that increase risk of bleeding, and that's the reason why I asked you to stop. But protein per se, zinc, magnesium, you can't continue, okay? So depending, we are going to guide you in this preparation for surgery the month before, but if your surgery is 6 months from now, you should be focusing on all of these supplements and having all that up to the stand levels that you need for normal levels so you can heal appropriately after surgery, okay? And the other, the most important one, and this specifically is after bariatric surgery, is anemia. Our bariatric patients tend to be very anemic. The reason for that is two things. One, it's the production of the little, it's called the intrinsic factor. It's like a little molecule that helps us absorb iron. It's decreased, and also through all these procedures, the size of your stomach is decreased. So the iron in our body is absorbed through the stomach. So the absorption in general, not only through the intrinsic factor, but also through the size of your stomach is decreased. So a lot of bariatric patients are anemic. So it is very, very important that you are taking your iron supplements, that you're checking your hemoglobin before surgery to make sure that we are on the levels that we need to. If you're having liposuction, especially BBL, the limit is 12. That's the lowest hemoglobin level. If you're having excisional procedures like tummy tuck, mommy makeovers, brachioplasty, I do, especially for bariatric patients, have a limit of 11 because I know it's very hard for you guys to make it up to 12. It also depends on your BMI, okay? Higher BMI, higher risk of bleeding, okay? So this one is very, very important. I didn't mention BMI, but in the 6 months of stable weight for surgery, your BMI should be less than 33.5, okay? It is better to have a BMI less than 30. That's what I advise and recommend to all my patients. But I do understand that the excess gain weights, and sometimes it's very hard to get to a BMI of less than 30. And in those cases, I evaluate like specifically, but for better results and decreasing complications, including wound healing, infection, and blood clots, not only in the legs, but also traveling to your lungs, which is more complex, which is a pulmonary embolism, a BMI less than 30 is ideal, okay? What do I do to decrease risk of blood clots? Mainly three things. Sometimes I add a fourth one. The three things that I do for everyone is I ask you to get up and walk. That's the most important one. If you lay in bed during your recovery, the chances of you getting a blood clot is very, very high, okay? So you have to get up, and that starts day of surgery, okay? Every hour for at least 10 minutes, get up and walk. Super, super important. The second one is a compression device. It's called VenaPro or Circulates. It is basically a wrap around your calf that it's battery operated. I'm going to give it to you when you come for surgery during the recovery. You're going to take it home and you're going to wear it for 2 weeks whenever you're not walking. That machine inflates and deflates to promote circulation. Basically, when it inflates and deflates, it acts like your calf muscle when you're walking and pumping the veins, so we circulate the blood and it decreases the risk of blood clots. The third one is your hydration, okay? Hydration is key because when you are dehydrated, the blood gets thicker, higher risk of blood clots. And the fourth one that I add to some patients, some patients that I do add it is depending on your where are you traveling, the length of the travel, and also if you have a BMI over 30, so from 30 to 33.5, and you're having a tummy tuck, I'm gonna add a blood thinner, okay? It's called Lovenox. It's an injection in your thigh that you're gonna start the night after surgery, and you're gonna put it for 2 weeks, okay? And the last thing I wanted to mention for preparation for surgery is what surgeries and how to organize this. This is very stressful for the majority of my bariatric patients because the majority of bariatric patients need multiple procedures. And of course, we want to do everything. Everybody's like, I just want to get everything done for one recovery, and then I'm done. That sounds perfect, but unfortunately, time of surgery then is too long. Maybe the recovery is it's affecting one area that you want to take care of while you're recovering from the other. So they're opposite recovery instructions. So there are some times that we just cannot combine everything. It's just not safe, okay? So what are the most common procedures that I combine for my massive weight loss patients? The number one and most common one is what's called the trifecta perfecta, and that's a Dr. Earl term. I give the props to him. It's a mommy makeover, so it's a breast and tummy tuck procedure with a brachioplasty, okay? And that way we take care of the majority of things when you're standing and like looking at your body from the front. The breast, the abdomen, and the arms, okay? That's the most common. There's some patients that don't have a lot of skin or don't want to address the breast and the arms at first, and we can do a circumferential body lift or like torso circumferentially. So it's basically a tummy tuck, but it extends all the way to the back to get also rid of the excess skin in the back, and it lifts the buttock and lower body. So that's why it's called circumferential body lift. We can do also, if you already have the mommy makeover or the tummy tuck at the front, then in the back we can combine procedures to rejuvenate the back and the lower extremities with a lower back lift or an upper back lift combined with maybe liposuction and fat transfer, because we're focusing on the back. So usually those are the most common things that we combine. What are the two things that we usually do separate on their own, because the surgeries are longer and the recovery is a little bit more specific to the procedure? One is face and neck lift. That we can combine with facial procedures. For example, very commonly we combine the blephs, so the eyelids with the face and neck lift, but not with other procedures of the body. I can and I do a fair amount of combination of blepharoplasty with mommy makeovers, for example, but not the full face and neck lift, okay? A lot of patients are choosing now to then do, like, for example, chin and face tight to the neck to get a better definition of the jawline with the bleph. I did recently that combination with fat transfer as well, so it's a little bit of liposuction in the waist. I'm doing a tummy tuck. We can use some of that fat to transfer it to the face to get some rejuvenation. So there are other options, and that patient I even did to the hands. You can transfer to the dorsal of the hand fat. With aging, you see some wrinkling and some loss of fat and definition of the hand, and you can see, everybody says, you can see aging with the neck and the hand. Well, we can hide it because we can put fat in the hand so people don't see the aging in your hand, okay? So all those little things we can combine when we're doing other procedures, but a major face neck lift alone and the other one that I like to do alone is a thigh lift, okay? The recovery of thigh lift is a little bit more involved because of the position of the scars and tends to have more wound healing problems, okay? So I'll get some questions now, no?
Your phone call.
Okay,
no, it's
yes.
3:32.
Okay.
So you don't have an appointment?
Yeah, well, you're gonna take 2 questions because there's a patient waiting for me.
Okay.
So 2 questions.
First, if my thighs are still big after a thigh lift, will doing thigh lipo after give me loose skin?
Sometimes, so we'll have to evaluate your particular case. So depending on where is the thickness and the quality of the skin, sometimes you can get some retraction. We can even do a revision on the thigh lift with some liposuction. The revision will be to tighten it a little bit when we empty it with the fat. That's another option. I usually do liposuction with my thigh lifts, so I usually combine those two because I think it's more powerful, the contouring of the thigh. And we remove that excess fat so we can tighten the skin more. So all of those are possibilities.
Okay, another question we have here is, ¿dónde es mejor poner el implante? ¿Debajo o por encima del músculo cuando hace un breast lift?
Muy buena pregunta. Cuando yo hago breast lifts, a mí me gusta ponerlo debajo del músculo. Si estoy haciendo un aumento de seno, simplemente que no estoy haciendo incisiones en el seno, simplemente, o sea, incisiones más grandes, siempre hay que hacer una incisión pequeña para un aumento de seno, pero si hago un aumento de seno solo, ahí puedo discutir con la paciente dependiendo del tejido, de la meta, de cuánto volumen esa paciente quiera, pues ahí discutimos las opciones de por debajo y por encima. Pero si es un breast lift, me gusta ponerlo por debajo del músculo. La razón es porque debajo del músculo tiene más soporte el implante. Ya tienes un seno que ha tenido caída, la recurrencia de la caída es más alta. Es mejor ponerlo debajo del músculo para que tenga más soporte. Y lo otro es que tiene más cobertura. Cuando tenemos un breast lift, el tipo de incisión más común es un ancla, alrededor de la areola en el vertical y en el plano horizontal, aquí donde las incisiones conectan y sometimes aquí se puede abrir la herida. Y el implante debajo del músculo pues está más protegido si tenemos heridas abiertas que el implante no se exponga.
Okay.
Perfecto.
3:35.
Okay, bueno. Thank you so much, you guys. If you have other questions, you can put them in the story, and later today I will answer through my stories like I do. I have a couple there that I need to answer, and I'll get to them later, but I'm running to see a patient now. Thank you so much. I'll see you guys next week on Tuesday Tips.